This chapter discusses the particular issue of adolescence. We are going to discuss mortality, morbidity, sexually transmitted diseases, Tanner staging, things like that. Adolescence, the definition is, first of all, it's a period that bridges from childhood to adulthood. It is a developmental stage. It begins typically at around 11 to 12 years of age. For most of us, it ends at around 18 to 21 years of age. There are physical changes. That's really related to puberty. And then there are psychological and behavioral changes. Remember that adolescence and puberty are not the same thing. Puberty is a part of adolescence. It is a physical change reflecting hormonal changes. These are causes of mortality in adolescence, and these are in order. The most common cause of death in adolescence is going to be accidents. They may not be wearing a helmet when they're riding their motorcycle, or a seat belt, or they may be jumping into shallow water head first. Who knows? So accidents are the number one cause of death in adolescence. Suicide is number two. And when we talk about suicide, remember that males are more successful than females when it comes to adolescence and suicide. Females will try it several times. Males usually get it right the first time. Homicide is another cause of as far as death. It's number three. And then cancer. There are certain cancers that are almost specific to adolescence. Remember, we talked about bone cancer occurs during periods of rapid bone growth during adolescence. We also mentioned Hodgkin's lymphoma, for example, as being common in the 15 to 19-year-old age range. So those are some malignancies that are almost unique to the adolescent population. Morbidity includes unintended pregnancies, sexually transmitted diseases, dropping out of school, running away. They're all listed for you there. The stages of adolescence are broken into early, middle, and late. The early stage really is more physical changes as they undergo puberty. During this time, behaviorally, they are comparing themselves with their peers. The middle stage, they start to become more independent and freer thinkers and not as concrete a thinker. They'll start having some abstract thinking. And the late phase of adolescence, they are less self-centered. They are thinking about future goals and plans as they mature. You absolutely, positively have to know your Tanner staging. Tanner staging is very important in that it will be asked as a question. They might say a patient comes in and has this, and this. What is the Tanner stage? Or they might say a patient comes in, for example, a girl comes in with amenorrhea, and they'll either say the Tanner stage or they'll describe the child, and you'll say whatever Tanner, you'll determine what the Tanner stage is and say, oh, well, she's not ready yet, so that's why she has amenorrhea. Or they may have a child come in, a male with gynecomastia, and part of your differential diagnosis is Klinefelter's, and they'll start describing the child, and you'll see that the patient is progressing through Tanner stages and the testes are developing appropriately, and you'll say, this is just normal variant gynecomastia in this male. We don't have to do anything. So that's the way you will get the Tanner staging questions. So the table is there. Go over it. The pubic hair is pretty much the same as far as the distribution with the Tanner staging, and then obviously separate one for the genitalia in the male versus the female. Puberty, a couple of things to remember is that it's variable in onset. Not everybody starts puberty at the same age. This can lead to some problems during adolescence because some children are undergoing puberty earlier than others, and part of adolescence is trying to fit in with your peer group, and they may not be fitting in. It's also variable in duration. Puberty can vary in onset and how long it lasts. However, there is no variability in the order of the changes. So those changes that you saw basically in the Tanner staging, they go in that order regardless. You're not going to skip stages. It is irreversible. You don't go backwards. And the other thing about puberty is that what's happening physically is a reflection of the hormones working on the end organs. Variants of puberty include breast asymmetry in girls, and generally you just have to reassure them. One breast may start growing before the other and grow faster, but they eventually catch up. Remember that with puberty, the first sign of puberty in females is breast development. Males, the first sign of puberty is going to be testicular enlargement. Another concern is irregular menses, and this is absolutely normal. The first year or two, at least, girls may have irregular menses before their period becomes regulated. And then gynecomastia in boys is a common concern, and again, reassurance is usually all you need to do. Sexually transmitted diseases in adolescents are the same as those in adults. We're going to discuss gonorrhea caused by Neisseria gonorrhea. It varies clinically. We talked about Neisseria gonorrhea in the newborn when we talked about gonococcal ophthalmia. So you can actually see it that early. We can also see a urethritis, cervicitis, a dysuria. Disseminated disease will cause arthritis and a rash. So when we talk about arthritis syndromes, one of them can be caused by Neisseria. You can do culture for the Neisseria, or you can also do gram stains. One thing to remember about sexually transmitted diseases, if you have one, you're at risk to have more than one. So you should always check the patient for more than one, because some patients have what's known as non-gonococcal urethritis, and we're going to discuss that in a second. Treatment of gonorrhea is now universally with ceftriaxone. Don't forget to treat partners. That's the hard part about eradicating sexually transmitted diseases, is treating all the partners and getting them cured. This is the cause of non-gonococcal urethritis, chlamydia. It'll present with a mucoid discharge in girls. The best test is going to be nucleic acid amplification test. The treatment is going to be azithromycin or doxycycline. If the girl is pregnant, treat with erythromycin, and again, treat the partners. Trichomoniasis or trichomonas, you can really see that in girls with multiple partners, and the key words here are going to be a frothy vaginal discharge on physical exam. Males tend to be asymptomatic. The other thing on physical exam is what's known as the strawberry cervix. You can do what's known as the wet prep, and on the wet prep you can actually see the trichomonas. Treat with metronidazole, treat the partners. Here is the strawberry cervix, very inflamed, all these little punctate lesions, and this is the wet prep, and all these little guys right here, that's trichomonas, that's trichomonas. Herpes is another sexually transmitted disease. We have herpes type 1, herpes type 2. Herpes type 1 is non-genital infections, usually the fever blisters or fever sores that you get around the mouth. HSV2 can be anywhere. It can be genital or oral, and you can actually see this in the neonates too. The primary site will be in the cervix. Remember to do the Zank prep. The Zank prep, you'll see giant multinuclear cells, and the treatment will be with acyclovir or valacyclovir. And here we see some lesions on the male of HSV type 2. This is a nice table that reviews the different discharges in the girls. It describes them according to the discharge, what you see on the wet prep, the pH, and whether it's sexually transmitted or not. And you can look at bacterial vaginosis versus trichomonas versus candida versus chlamydia and gonorrhea.